Appreciate all of you being here. This is the CHIP work group for the elder age band, and that's actually going to be one of the questions I'm interested to hear from you later on, is whether elder or senior, or what the right terminology would be for this group. So I'd be interested in your thoughts about that. Can you guys see my screen okay?
Yep. Mm-hmm.
All right, great. So wanted to just share the agenda with you. We'll just do welcome and introductions, then talk a little bit about ground rules and commitment. I want to talk a little bit about the history of how we got here into this group that we're in now, and then look at some data, particularly that's associated with seniors in our committee or in our community, and then really do some brainstorming around goals. That's the main actions, and then talk about next steps for this group. So I will start with introductions, and I think just to avoid confusion, I'll just call on you if that's okay, and if you could just do a short introduction when I give you a holler. So Troy, why don't we start with you?
My name is Troy Server. I am with the City of Port Townsend Police Department, and I am currently the police chief.
And Dunya?
Hi, I'm Dunya. I'm the Director of Population Health at Jefferson Healthcare.
And Sheriff Knoll?
Hi, I'm Joe Knoll, the Jefferson County Sheriff.
All right, Miranda?
Hi, everyone. I'm Miranda Nash. I'm the Mobility Operations Manager with Jefferson Transit.
Heidi?
Heidi Eisenhower, County Commissioner, District 2, and I was informed this morning I'm coming to this committee because I'm the eldest of the commissioners by like a few months.
Jim?
Jim Novelli, Executive Director, Discovery Behavioral Healthcare, and I guess I'm at this meeting because I'm just over the hill. So.
There was no intent to to imply age for participation to this.
That's okay.
And Nancy?
I'm Nancy McGonigal, and I have volunteered for several years for an organization, a volunteer organization called SHIBA or SHIP, which provides Medicare help, healthcare access help for seniors and the disabled.
And I think that's everybody. Did I miss anybody? Oh, yeah, Lori, sorry.
I'm Lori Fleming, Co-Executive Director of CHIP, along with John.
Thank you for raising your hand, Lori. All right. So welcome and introduction. So this is kind of a review of the ground rules. I'm not going to read each one. There's a couple that I want to emphasize. One is, assume good intentions. And everyone that's in this room really wants to do what's right for seniors in our community. And we may not always have the same thoughts about how to do that, but I know that everyone here really wants to try to do that. And then it's, we come from a lot of different backgrounds and situations, but once we kind of jump into the Zoom or Teams room, we're all kind of equal and our ideas are of equal importance. And I want to make sure that everybody has an equal opportunity to participate in this group. And then a little bit about the commitment. We're going to probably be meeting monthly is kind of my goal. My hope is to complete this work by summertime. So, hopefully July, August timeframe, we would be done with this work. We're not meeting all that frequently, so it'd be great if you can attend as many meetings as you can. I know all of you are busy folks, but I would just encourage you to be able to do that. If you have to miss a meeting, I'll make sure that I catch you up on that. And then the last one, this one I want to talk about is just kind of everybody needs to get on board. Once we make a decision moving forward, it may not have been the choice that you made, but what we want to do is make sure that as a team, we decide that's the direction that we're going and that we're going to move forward. And then the last kind of setup slide is about the overall purpose for this team, and it's really about improving the health outcomes for the residents of Jefferson County. One thing that Lori and I have learned doing this work over the last few years is that developing links between different agencies has been incredibly powerful and helpful in the work that we do. And so it's great that we have representation from so many folks in the community that represent so many agencies. We're going to really try to be data driven and make sure that we look at data to help inform our decisions. And some of you will have access to evidence-based research about what's best for elders. And if you have that, we'd love to have you contribute that as we go along and do this. So any questions about kind of the ground rules or kind of set up for what we're doing? That all makes sense? All right. So I'm going to run through kind of how we got here. And this is a review of the community health assessment part of the CHIP work that we've done in the last couple of years. And some of that data is driving the work that we're doing. So we started with an online and paper survey, and we had an amazing response to that. About 1,200 people in the community responded. So that was a really strong showing. We did community forums in Port Townsend, Chimacum, and Quilcene. We interviewed 12 key informants that were kind of health decision makers in our community and had a lot of insight into what drives health in our community. We partnered with Kitsap Epidemiology to do a quantitative analysis of the health of our community, and some of the data that I'm about to show you is from that quantitative study. We took the early data to the joint board, which is the health board and the hospital commissioners and one city council member, kind of reviewed that information with them. Then we did some community forums, again, Port Townsend, Hadlock, and Quilcene. And then the step we're on now is really CHIP plan development. And we worked with a group early on to review the community health assessment data and to establish some early priorities for the work of CHIP moving forward. And you'll see some of that data as I move forward through the slides. So this is just kind of a representation of that. The thing that's significant in that is that the team that did the early assessment of the data from the community health assessment changed the way that we were looking at how to kind of sort through the health of our community. The original team looked at some priorities like immunizations, chronic disease prevention and healthy living, chemical dependency, and mental health. And the further group decided to separate, instead of using those high-level categories, decided to separate groups into age bands. And so that's why we're here. There's a youth age band, a working age band, and an elder or senior age band. So, and I think it actually is a good framework for us to be able to start to look at the health of our community and see what we can do, because I think the issues for those groups can be really different. So the group that did that early analysis of the community health assessment and recommended the age bands also took an early stab at what the priorities for the elderly age group should be. And they determined that preparation for aging population in our community was number one, kind of overwhelmingly. And then the second one was strategize on a community-wide advance plan. And that's kind of been confusing to some people, but I think what they were getting at is advanced care planning, so kind of end-of-life planning and making sure that we have the resources in our community for people to be able to do the planning that they need at the end of their life. So this is a suggestion for this group. It's not it's not the final goals that we will put into the framework that we're going to use to do this, but just know that that was kind of what they suggested. And a large part of the work today is going to be a brainstorming around what the priorities might be for this community, what the high-level goals for elders in our community will be. So you might try to keep these things in mind as we start to have that brainstorming discussion. This is from that community health survey that we did, the one that 1,200 people responded, and this is from all 1,200 people, so it's not segmented by seniors. This is what everyone that completed the survey felt like the most significant issues facing seniors, people over 65 in our community. And the other thing we did is a little bit of a deep dive by community. So there's first column is Jefferson County as a whole, then Port Townsend, then Tri-Area, and Jefferson South, which is basically Quilcene and Brandon. And you can see there was a lot of agreement. The top 5 issues were, for the county as a whole, were living on a fixed income, social isolation, cost for care, housing, and managing health problems. A little different in the South County, where transportation was a little bit higher of an issue, kind of as you would expect. And then this is, again, all 1,200 respondents. This is what they felt like if we could do these things in our community, these would be the, what are the top 5 things that might make life better for all of our community. This is not directed specifically at seniors. And so the top 5 that were listed were affordable housing, jobs, better access to mental health care, less substance abuse, and improvement in poverty. And again, you can see that pretty similar among the county. There's a few things that were different in South County. Dental care was identified down there. It was on the top 5 list, but you can see generally pretty strong agreement. And then this slide kind of is sobering and also, I think, tells us a little bit about the importance of our task. So this is by 5-year age bands, what the population of Jefferson County looks like in terms of how people are grouped. And you can see from 1990 to 2018, when this ends, that in 1990, there was a pretty good distribution of all the different ages in our community. But over the last almost 30 years, and now it is 30 years, we have become a very old community by average age. The highest group in this community by age is 65 to 69. I'm sure many of you have heard this before. We are the oldest county by average age in Washington State, and we are the 6th oldest county by average age in the United States, which is even a more sobering statistic. So the work of this group is really important and probably will impact more people in our community than any of the other groups, just because there are so many older residents in our community. And I think it was kind of sobering to me as we started to form on these age bands. There are a number of groups that are working on issues of youth in our community. There's a number of groups that are working on issues for the working age in our community, but I could not really find any groups that are working specifically on the issues of elderly in our community. There are agencies like OAAA that are doing that work, but in terms of teams of interdisciplinary groups, there really isn't much activity in our community about that. And to me, that makes the work of this team even more important. So a big task in front of us, and I think with that comes also a lot of opportunity, because there's a lot of, if we can make improvements for elders in our community, it'll make a huge difference for the residents of Jefferson County. So this isn't specifically about seniors, but I thought it was important to show that there are issues of income and poverty in our community. I think what's alarming to me on this slide is that the gap between Jefferson County, which is in blue here, and Washington State, which is green, has widened pretty significantly over the last 20 years, and that we now don't compare favorably to Washington State. So we are, you know, while the average income has increased, it hasn't increased nearly as quickly as the rest of Washington State. And so we are a poorer community. And then this kind of goes with that. This looks at the gap between the average income in our community and the average cost to own a house in our community. And you can see again, that gap between Jefferson County and Washington State has been widening over the last few years, which means that it's harder for people to buy a house in the community. This is adults with leisure time activities. This is one of the slides that had kind of some positive news, which is that compared to other people in Washington State, people in Jefferson County are more active, and actually that's been an improvement over the last few years. And when you think of this in terms of the age of our community, it's an even more impressive slide that people are out there and being active. This is people over the age of 65 that are getting pneumonia vaccines. And again, you can see we've made pretty significant improvement in this area. Some of you probably know that my other full-time job, in addition to my CHIP work, is at Jefferson Healthcare. That was a little joke for those of you that picked it up. And we've made a huge effort in the last few years to increase the number of people getting Pneumovax, and it looks like that effort has paid off. So any questions about that data review or any thoughts about that folks would like to share? All right. So that's intended to kind of be a background for you for the next step, which is really what I would like to do for the next 20 to 25 minutes is kind of brainstorm what you think should be the high-level goals for our community for elders. And one thing that Lori and I have learned doing this work, the first CHIP plan had 309 activities in it, and it made it incredibly difficult to be able to accomplish that. So we're really trying to simplify the plan this time and make sure that we narrow the focus of what we're trying to do. So we're really after 2 to 3 very high level goals, and underneath that we'll do strategies and objectives and activities. But today is really about trying to nail down those top 2 or 3 goals for our community for seniors. Heidi, I see you have raised your hand.
I don't know how you guys normally interact, but I figured that was one way. But I just wanted to, as you were making that presentation, I guess I got my most area of kind of questions around the priorities. And it seems like now that we're at this level of considerations for brainstorming, we would want to reflect on the priorities that were identified, right?
Yeah, I can go back to that slide if you think that would be helpful.
And I was kind of curious about what prep for the aging population was. I mean, what is preparing for aging?
Yeah, I mean, I can talk a little bit about what people talked about when they listed that, but it's, you know, things like developing infrastructure to help people keep active so that they can stay independent as long as possible. A lot of that was really structured around keeping people at the most independent level that is possible for them. So those people that are currently, you know, not in an assisted living, that are living independently as seniors, keeping them independent. Mm-hmm. Those people that are in assisted living, keeping them out of a long-term care facility, and those that are in long-term care, keeping them, you know, healthy and as happy as they could be. So when people talked about that, the goals were really around, you know, what can we do that'll help keep people independent and able to live in their you know, in their native environment, whatever that is. And I'll go back to that slide that had the priorities on it.
I mean, it seems like we would want to brainstorm goals through the lens of what the highest priorities were, right?
Yeah, I mean, this was actually at the, you know, the thought was that these were kind of at the goal level, but I think, again, it's really for this group to establish what they think the goals are. And the intent of the first group was just to give you a little bit of a roadmap, but not restrict you to their goals. Someone else has their hand up. There are two.
Joe Knoll.
Okay, 2 JN, so I wasn't sure which one it was. Joel?
John, before Joe speaks, could you make it so that we can see the people? And switch the slide down?
If you want to switch between viewing the slide and the people, just click on someone down at the bottom. Should open them back up.
Did that do it? Laurie, if you're talking, you're on mute. Sheriff Knoll, why don't you go ahead and talk while I try to figure this out?
Yeah, okay. Yeah, now I'm trying to find myself. I forgot that Jim Novelli was JN too. Anyway, yeah, I guess I'm just, you know, throwing this out there. But I guess what I think are priorities, and it doesn't necessarily go along with everything that's on the list there, but I think from what I'm seeing in my field, I think dementia support, I don't know, it just seems like we're having more cases with that involved, and some, you know, mental health access availability. And then this isn't on the list, but we see this a lot too, is some kind of fraud prevention or something for elders. So I'm just throwing that out there.
I second that with the fraud. It's concerning how much money they lose and how easy they can be taken in.
Thank you, Troy.
Since there's so few of us, I think it might be good to just go around the room and kind of see what people are thinking in terms of, you know, what they feel the issues are. So Sheriff Knoll has kind of talked already. Jim, do you mind going next and kind of giving your thoughts about what the highest priorities are?
I had a short stay working for the state for APS for a while, Adult Protective Services, and I got to see a lot of things with the elderly, and I think, you know, which the police chief just said about fraud, but there's a lot of families that take advantage of the elderly and defraud their own mothers and fathers. And on top of that, you know, the neglect and the that occurs in their care. And many of these people don't have access to information or really don't know where to turn. You know, I work in the mental health field basically, and getting mental health is really difficult for those individuals, because part of the struggle is in an area like this, which most of those people are in Medicare, and Medicare only pays for certain services when it comes to mental health. It's really restrictive in the sense of just therapy, and that is troublesome because they're trying to change that. In fact, it's before Congress again. Only licensed clinical social workers can provide therapy, you know, and get billed for it, pay for it for Medicare. It doesn't help for licensed. You can have licensed clinical mental health counselors, licensed marriage and family therapists. You know, it's a struggle because they can provide the same therapy, but because of a strong social worker lobby, it rules out them as billable services. And that's the problem with our community mental health center here is we have a lot of Medicare eligible people, and it's hard for us to provide those other services like case management, things like that really are not paid for by Medicare. You know, and so it's a real struggle. So I think getting access to services sounds really, you know, everybody says that, but there's some changes that inherently that are above and beyond our capabilities that have to change at either a state or federal level to have things occur, and would open up the doors quite a bit for for those people. But I think when I looked in this area, a little bit of work I did with APS around here was really the amount of neglect of the elderly and really families preying on their own parents. When we look at their money disappearing and not even aware of it. And then I guess I would have to second what Joe Knoll about dementia. I mean, that is going to be the biggest increase in our population moving forward. And dementia care is very difficult to find, and it's a very hard process. You go to some of these dementia units that are out there, and it's really, really hard to maintain people in those units and even find a good unit that can take care of that. But those are all on the hit list, I guess, of things that are really troublesome for people that are thinking care for their parents or care for the elderly. Where do I turn? Where do I find help? Where do I get access? So I think I've said enough now. But those are things that are all on the top of my list.
Yeah, that was great. Jim, can I just ask you a quick question?
Sure.
Is there any legislative intervention that we could do to support the broadening of the the care people are allowed?
And it's mostly at the federal level because CMS controls Medicare. So I would say writing to your state, Congress representatives and to the state and the federal senators, those would be the ones that really push this through. And this has been before Congress multiple times and keeps getting shot down, but it's about to go through again, and hopefully they'll open up those doors. And I mean, if they open up the providers, the level of licensure, it would really make a big difference. It would open our doors immensely. I mean, but treating Medicare more broadly, yeah, I would say you reach out to like Senator Cantwell or whatever, our other senator or our Congress representatives. Those are the people you have to keep petitioning.
Okay.
Yep.
If you know of a specific bill number, do you mind emailing it out to the group? Just because there are probably others in this group that would send letters as well. So, Nancy, I'm wondering if you would go next. I think you have a lot of contact with seniors, probably more than anyone else in the group.
Okay, so I think my camera is turned off, but I can just talk, John. I agreed with everything that's been said so far. And this is a kind of a side to before I begin, but the adult protection services and so on, we see a lot of people that are being used, but I don't know that they can ever be protected within the law. It's really, really, I mean, I agree with everything that's been said so far, but from a broader view, I feel the most important thing is affordable housing, apartments, housing. Someplace I know a woman who lives in a basement in a 100-year-old house. To some place for seniors that's affordable that they can live. To me, would be the most important part of the committee. But going back to my experience, SHIBA, I didn't explain what that is. That's a state health insurance benefits advisors, and I'm trained and authorized by the state commissioner, and we basically have clinics. We have to be trained regularly. We have to be recertified every year, but we can give help, but there's not much we can do. We have to act within what our boundaries are. Fraud isn't important. I mean, I think that I am just thinking this is going to be a really important committee. That's, John, that's mostly my response so far. I really am interested in what I'm hearing. And there's some big issues here.
Thanks, Nancy. Dunya, do you mind going next?
Not at all. Let me know if you cannot hear me. Like I said in the chat, my internet is super sad here at home. So again, I represent the healthcare system, and I was the person who organized the convening last October, not this last one, the one before, on the health of older adults in our community. And from the healthcare system perspective, I'm really interested in having a age-friendly health system, that focuses on those 4 M's, which are mentality, mobility, medication, and what matters. And so I really like that as sort of a comprehensive view of what I would like Jefferson Healthcare to sort of focus on, and one of the things that we've been looking at as well. But I find a lot of excitement thinking about this issue when I consider even things like the built environment, which of course, John, I'm always the one who's telling you to like narrow and focus and make sure we can do actual things. And then out of the other side of my mouth, I'm talking about like making sure that text in our elevators is big enough for people to see, and like, you know, making things super obvious of where it goes. But I think that we could do a lot through this group. What came out of that convening was it was about 120 people from not only our community, but also Clallam, Whidbey Island, a few people from Mason, and a few people from Grace Harbor County came to talk about older adults. And really for Jefferson County specifically, they was looking at social isolation within our elderly population and how do we address that. And so I'm open to a lot of different things. I think what the hospital is looking at specifically is around an age-friendly health system and what that looks like for us. But I'm psyched to be here. I think that there's a lot of things that this group can do. Yeah.
Thanks, Dunya. Heidi?
I would just say I have a lot of elders in my life and spend a lot of time with them. So that's my most probably applicable experience or personal experience to this group, but I think it'll be useful. And I think that one thing that I see the elders in my life doing is trying to stay physical, trying to stay healthy that way. So staying active and kind of in the prep for aging goal, you know, it's like, how do they stay active? So I guess I would be interested in, you know, building systems or programs that support active elders. And we have a lot of them in the community. This is a community of lifetime learners, and how can we, as within the work of this group, reinforce that or draw more people into that way of being? So active elders.
Great.
But I'm troubled to hear about all the kind of people taking advantage of, and it's something that I am mindful of with the elders. I know some of them have lost their spouses and are alone now, and I'm spending more time reaching out to them and just a little bit worried personally about the elders in my life. And I think that would be a good thing to focus on, is how to make sure they don't get taken advantage of.
Thanks, Heidi. Miranda?
Hi, everyone. Hi, John. I saw you last week at their CAC meeting. John
Yes.
sits on our Citizens Advisory Board at Transit. And I'm going to introduce myself to Heidi Eisenhower because she is going to be sitting on our authority board. And I think we've got a meeting coming up in the next 2 weeks. So I'll see you again there. But it's a good opportunity for at least 3 people who have ties with transit in our community to provide some input here. So transportation in Jefferson County, especially in the more rural outlying regions, it has a big effect on people's ability to gain access to health services. And you know, public transit, it is limited in many ways, especially in a rural community, because what you're dealing with is frequency versus coverage. And in our cases, in the outer lying regions, we opt towards coverage because there's a trade-off there. But that then means that people who live in these outer lying regions have limited ability on time to get in. And, you know, depending on people's schedules on making health appointments, it can be inconvenient. So one thing they don't say about public transit is that it's super convenient. Having a car is convenient, but as people grow older and you know, they can lose their ability to be able to drive themselves. They start to see existing health conditions exacerbated, or they start developing new health conditions. So transportation becomes an important part of it if they're limited in their ability to find transportation themselves. in our community, transportation seems to be a big issue, not just in the elder age, but even in the younger ages too. Public transit, we have our fixed route services, and then we have our paratransit services, which are complementary to fixed route. It's not an age-based service, so a lot of people who, they may have some health conditions that make it more difficult to use the fixed route, but it's not an automatic qualifier. Disability or health conditions that prevent people from being able to access or utilize is the key part of eligibility on Dial-A-Ride, and that's a door-to-door service. So it does become much more convenient for people at that point, but it's still complementary in that the service areas are the same and the service times are the same. So even in those outlying regions, people with disabilities or health conditions that prevent them from being able to use public transit on the big fixed route buses, they still have to kind of work with the limited schedule and availability. And it's also shared ride. And given the COVID climate that we're in right now, that puts an added thing on top of it, because you want to maintain social distancing. And so it's become a little bit trickier navigating transportation right now. One of the biggest things for people and I'm sure that Dunya can kind of attest to this, is when we think about transportation as a kind of a fundamental part of health and people's health care, the follow-up appointments are really essential, especially when people have an episode or something that leads them into the emergency room. Follow-up appointments are really essential. So being able to access those appointments, it actually reduces the number of times people end up in the emergency room or have an emergency call out. So it's kind of like a domino effect on our public services. So not only is, we're having a higher frequency in our emergency services, the call outs of providing, if we can reduce the service, to the more critical things, if we can reduce the number of emergency call outs or emergency services or ambulances, responding to people who could have prevented that by having regular access to healthcare, it's an important part. So transportation becomes one of those things where you don't really think about it until you need it, because having a car is really convenient. But it's a big concern in our community, because we are more rural, so we have more limited options. We do have some community services like ECHO that are volunteer-based, that have provided services to the community. But given COVID and in the last year, those organizations have been struggling, and I'm seeing a lot less of their impact or availability in the community because of that. So we're seeing a lot more requests for transportation, but the fact is that people don't always qualify for Dial-A-Ride services. And with paratransit through the state, they have to be Medicaid eligible. So either they're paying for a high premium of services like a taxi ride, or we don't have rideshare like Uber in this community, so you are really limited to like paying for a taxi or one of the other services that, if they need to get over to Seattle, it's Rocket Transportation or Dungeness Lines. It does get fairly expensive, so we don't really have a great solution here. Public transit is one solution, but I think that exploring ways that we can partnership with other agencies, because public transit does have some limitations in what it can do. So I think there's room to explore, or look for opportunities on how we can better make transportation services that do exist within our community better coordinate, so that we're not having overlapping services, and we can push those services to better use. So we're not providing the same level of service to an area that has, kind of make it redundant, and utilize those services into the outer lying regions, so that people out there can have a little bit more transportation services to get them to where they need to go.
Thanks, Miranda. That was helpful to get that perspective of transportation, and I'm really glad you're participating with this group.
Absolutely.
Troy, I think you're the only one who hasn't had a chance to. I know you chimed in on Sheriff Knoll's ideas, but interested in your thoughts as well.
Right, Joe had mentioned a couple of things. When we do have an event, we have more than the county does right now for dementia. It's a little bit easier for us to find the folks when they need help, just because our community is a little bit smaller. Might be a little bit harder out in the county just because it's so wide open. We talked about the scams. I think just kind of like an updated data sheet to get out to the community on a regular basis. You've been scammed, such as how can you win a lottery that you never put in for? If you get an email from Amazon saying you have a $25 gift card, you probably didn't get it. Don't respond to emails, go to the actual account. So if Citicorp, I've got 3 of them today from my Citibank Visa, which I don't have, says that my account's been hacked. So if I did have a Citibank Visa, I would go to my credit card app and access it from there. A lot of people are accessing it from their emails, and I'm just suggesting not to do that. And so if we come up with a sheet that we keep up to date, no Nigerian princess, and none of that stuff, it still comes back up. A close friend's mother lost tens of thousands of dollars. I've helped lots of people who at the last second, who are just about to send money out, they'll call up and say, hey, I'm kind of worried about this, but I already bought the gift cards. And we're just like, oh, don't do that. Just call us. We'll help you with it. Another one like your granddaughter's in Mexico. That was one we just had. She's in jail in Mexico. Sent us $400 in gift cards, and the gentleman was about to do it. Then he called us, and so we helped him out on that. So there's a whole bunch of ways to get scammed, and it's not necessarily even the elderly, but we do see the elderly, especially if they have means, give away tens and twenties and $30,000 worth of money. I had a gentleman. I've been friends with him for 2 decades. And he sent $30,000 out multiple times, and even argued about sending another $10,000 out, even though his financial manager and I were trying to convince him not to do it. So they just get dug in. Then the next thing, it has to do with transportation. It was kind of brought up earlier. I am seeing lots of elderly folks doing lots of walking now and riding bikes and electric bikes, and I think it has to do with the COVID. And whatnot. I really want them to wear a vest. It scares me when I get up in the morning. It's not so bad now because the light's coming up, but I'll come up and I'll see this black shadow moving, and next thing I know, it's someone walking with their back to traffic. They don't have a vest on, and I just want to make sure they get to where they want to go, and I want them to exercise. And then electric bikes. I'm seeing a lot of electric bikes being used. I'm also seeing people who seem like they're just a hair away from being reckless on the bike and going off the cliff or into the water because they're going pretty fast. so it is concerning. I do want them on the road because they are getting exercise, but they just need to be careful when they're riding their bikes and being safe, and also wearing a vest when they're out too. But you folks have brought up a whole bunch of major things. Mine are more just, I just want these folks to be safe and exercising.
That's great. Troy, some of what you're listing is probably, I'm going to show you kind of the overall framework that we're going to use, and a lot of the things you're talking about are kind of at the activity level, but I think we'll be able to plug those things in. So keep those in your brain, and we can make sure we get them plugged into the right place in the plan when we put it together. And those are all really, really great suggestions, I think. So this was really, I did get everybody right. Everybody had a chance to share.
I want to add something.
Sure.
Sorry. Joe here. All this talk about physical activity, I was wondering, what about those elders of us that want to nap? What preparations are being made for us? That's a joke. Also, I just want to say a couple things. The transportation part, I didn't even think of, and I think that is so important. And the thing about the fraud stuff, I mean, we have that going on now, but when I think of it as the growing aging population, that will just become a new way of making money. And it really, I mean, Troy was given all kinds of examples, and I guess one that really bothers me, and I think, I can't remember who said it now, maybe Jim Novelli, but a lot of times the suspects are the family. And so anyway, lots of good things being talked about here. So, but I wanted to find out about a napping consortium or something. So,
Thank you, Joel. We all need a little humor in our lives.
Maybe we can have Jefferson County emblazoned mats for your nap.
The potential for infographics is huge in all of these topic areas. As Troy was giving examples, I was seeing amazing infographics that could be on the buses and in the libraries when they can reopen, but that would be catchy and, you know, that people would remember.
All right, I am gonna share my screen again. I'm sorry if you all will disappear. That's a little bit of a limitation maybe of the software I'm using. Lori and I talked about maybe using Zoom next time, so we might do that. But I want to share with you a little bit about, some of you have probably participated in the work of the ICG groups that have been doing some COVID remediation using care funding. And that group actually developed a plan for our community in terms of their activities. And Lori and I want to make sure, one of the things we try very hard to do is make sure that we're aligning with other work that's going on in our community and not duplicating those efforts. So we took some time to look at their plan and kind of crosswalk it with the 3 age bands for CHIP. And so what we tried to do is look at their items and see where there are opportunities for overlap. And so I'm just going to kind of show you these slides real quickly. They're in your packet. You can spend a little bit more time looking at them. But these are places where we might be able to align with work that's going on in our community. And you can just take a look at that elder band, and if you're interested, certainly in the other bands as well. But you can see that there is quite a bit of work that's going on in our community already, and that we want to make sure to try to align with that whenever we have a chance. So,
John, can we suggest additional checks?
Sure.
Because I saw the affordable housing wasn't checked for elders, but I heard it brought up today in our group.
Okay.
And I would agree with that.
Absolutely. I second that.
I'll get you a cot, Joe.
And I think I'm just about at the end of this. Again, this is in your packet, so you can take some time to look at that. So then kind of moving on to next steps. I'm gonna send out a packet to you after this meeting, and what it will have is all of the information from the community health assessment. It's just the quantitative analysis is 160 pages, so there's a lot of information in there, and I'm not expecting that you look at all 160 pages. It's just an opportunity for you to kind of review that and see if anything jumps out at you in terms of that. I'm also going to send you what's called the strategic framework, which will show you the framework that we're going to use as we build the plan for the elder age band in our community. So this group will fill out that strategic framework. Lori and I are going to take all 3 of the frameworks and develop a revised CHIP plan during the year 2021. Our hope is to have a draft by August, which is a pretty aggressive time frame, but that's kind of what we're doing, what we're hoping to do. And then we'll be presenting that to the joint boards, which is again the hospital board and the health board. And then these are the elements in that strategic framework. So there's goals, objectives, outcomes, strategies, activities, resources, and timeline. And this is to kind of give you a definition with what goes in each section of that plan. And what we were talking about today is the goals, which is at the very highest level. And then this is just a framework, again, to use for that, using kind of the SMART strategies: specific, measurable, attainable, realistic, and time-oriented. And then this is what that strategic framework looks like. And again, what we were talking about is the highest level at the goal level. And listening to the conversation today, I came up with two very high-level goals that might be appropriate. I'm not going to pencil them in yet. What I'd like to do is read you what I'm thinking, have you guys think about it between now and the next meeting, and if you agree that those large area goals are appropriate, then we can kind of pencil those in and start to move down to the level of objectives, which are actually some of the things that you guys suggested. So at the goal level, what I'm thinking is two high-level goals. One is access to services, and that would include things like transportation, dementia care, housing, mental health services. Those would be objectives or strategies underneath that. And then the second one is something that I just called aging well, which would have things like keeping people active, how to protect them against fraud or, family taking advantage of them. And then some of the things that Dunya had mentioned in terms of, mobility and medications and things like that would go under that. Some of the services that Nancy's group offers in terms of, helping people to make sure they get the full advantage out of their Medicare benefit and things like that would go in that group. There's actually a class that was taught in our community for a while called Aging Mastery that had a number of those elements in it, and that may be a strategy that we choose to employ. So thoughts about, does that seem like kind of on the right track? Or do is there something else you can think of that might be a better big bucket to put these things under, or I think that's kind of on the right track?
Seems like the right buckets to me.
Okay, well, why don't you guys take some time, we'll meet again in about a month, take some time between now and the next time that we meet and see if those seem to fit within that. I will likely take a lot of what you guys listed and try to start filling that into the plan under these two goals, just as a straw man for us to talk about at the next meeting. Sometimes it's a little easier to have something to react to. So that's some homework that I can do to kind of help move things along. And I will share with you that I will have no investment in what I put in there. So I'm hoping that you guys will, if something isn't right, you guys will definitely say, hey, move that, or you didn't get it right. So it'll just be something for you to react to and maybe speed up the process a little bit.
That sounds great.
You were talking about thinking about how that fits into the strategic results framework. Is that right?
Yeah. So if we put, again, access to services, one of our objectives might be to create some kind of a resource map of dementia services that are available in our county and make it available to seniors to be able to see that, or maybe it's pursue a grant for improved dementia services in Jefferson County, or and then in the housing, it might be aligned with the existing housing groups that are already in our community and make sure that they have seniors as part of their part of their plan. Anyway, that's kind of what I'll try to do, is weave thoughts that you guys have expressed today into this framework that you can see on your screen now. And again, it'll just be a straw man, just something for you guys to react to. I am gonna stop sharing my screen for a minute, and we're kind of at the end of our time. I did want to ask that question, elder, senior, do you guys have a strong opinion one way or another about what to call this group?
It seems like senior might make it more accessible to seniors, you know, if that's who we're focusing on. I mean, I call elders, you know, my elders. It feels like a different definition of elder to me, but I like the word elder. So
Does
that
anybody
wasn't
have a burning passion one way or another, feel really strongly about it? I mean, I want to be,
I guess you could be
politically correct, I guess.
You could be old fashioned. We're always told to respect our elders, right?
Mm-hmm. Yeah.
I would think seniors would be, I think that elder carries a perception.
Okay. So I've heard 2 for seniors, so I'm going to change our name to the senior age band from the elder age band, if everybody's good with that. So.
Thank
Lori?
you.
Hey, I just wondered if we could maybe see if among this group, if meeting a month from now, so it would be the second Wednesday of the month, which would be March 10th at the same time. Does that work for everybody's schedule?
Thanks for doing that, Lori.
Mm-hmm.
I'm looking. Yep.
Works
For me, it does.
Okay, we'll get an invite out to you and we'll change the name at the top of the webpage. You may have noticed in the chat box, we've given a link, which we'll be sure to send out to the elder, or now it will be the senior webpage for this group, where we'll house the resources and videos and meeting slides, that sort of thing.
And I want to give Lori a shout out. She's done an amazing job with our webpage, and there's a lot of information out there. Feel free. It's behealthyjefferson.com, and it's there's an amazing amount of information out there, including all the information from this meeting. So yeah, looking forward to meeting with you guys more. This is really important work, I think, in our community, given the number of seniors that there are in our community.
Absolutely.
I really appreciate you all participating, and we'll talk soon.
Thank you.
Thank you.
Bye, you guys.